What form of zinc is best for immune system?
First, we have to conclude, prove, have conjecture, et cetera, that zinc is good for the immune system. Now, in most cases, I feel that it is. Zinc fuels many, many processes in the body, or is involved in many processes in the body, which, if those break down, many of them will cause an immune dysfunction. With COVID and other viral illnesses, it was really, really a hot topic, because if zinc levels are high enough in the cells, then the virus has difficulty replicating. Now, that's not the only mechanism, but that's the one I generally talk about because it's the simplest and easiest to understand. And then we get to the question, which is the all-encompassing question for everybody all the time, is, should I take X? And the answer is, if you are deficient in X and you take X, you'll probably feel better. For example, in my case, I tend to be deficient in B12. When I get B12, I get really juiced up. I get a lot of energy. Other people who are not deficient in B12, it makes zero difference to them because they're not deficient. Zinc would be kind of in the same category. Now, we actually will, in some patients where we have a suspicion of a zinc deficiency, we'll actually run a zinc test. We'll do a red blood cell zinc content, and we'll also do a copper content, because zinc and copper, there's a particular ratio that they should be in for maximum health, and you don't want it to get skewed too far one way or the other. So particularly if I'm going to give someone copper long-term, and I do very, very, very minimal iron supplementation. Iron is actually quite dangerous in excess. And so I'm very careful about using iron supplementation. Now, I sometimes do it. I'm just very careful. I don't just throw iron at people, which has been a common treatment for practitioners historically. I'll want to do copper levels, which helps with iron movement and assimilation. If I'm doing copper, I'll also do zinc. Or if I'm giving copper as a supplement, I'll generally do a zinc test and see if we also need to do zinc. Okay, so that's the beginning. Now, when you're dealing with zinc, as with most minerals, this is not 100%, but pretty close. You want a form that ends in the suffix ate, picolinate, citrate, malate. And this is true certainly with magnesium. You really want those forms. You don't generally want magnesium oxide. Very rarely, if you're really just doing a bowel cleanse, you might want magnesium oxide, but it doesn't absorb. The variety of minerals where the form ends in ate generally tend to be easier to absorb. They are bound to other chemicals that make them much more absorbable. Now, my favorite is zinc bisglycinate. I like zinc picolinate also, but not because they're particularly better for immune function, because I think most zinc is good for immune function. It's just a matter of being able to absorb it into your system and then get it into your cells where it's actually going to be protective for you. And so those are a couple of the forms that I really like. However, anything that ends in an ATE form is probably going to be okay.